let's talk now about nerve mobilization. So what is it and how does it work?
So nerve mobilization is a newer type of therapy that basically aims on freeing tensions within the nerve and itself and the tissue surrounding it, and the pathways that it runs through the body. So the nerve, goes through a tube. It's called a nerve, like a sheath that it runs through, and often it can get tensioned or pinched on or compressed, and is not able to freely kind of slide and glide and move through its tube. And so when the nerve itself is fixated or tensioned or pinched on, it causes many different types of symptoms, and sometimes anything from I feel it mildly to absolute, severe either pain or lack of movement. It could cause paralysis even, and it could cause numbness and tingling and burning sensations, and there's many symptoms associated with nerve that can be quite confusing for a patient. Sometimes patients come in and it can move around. It can be one day they could feel it here, and then they could feel it not here. They could then feel here and lower, and it could change throughout the day. And they come in really confused. They'll go to different doctors, and maybe they won't find anything on an MRI. And a lot of times what I'm dealing is in the subclinical. So nerve mobilization really aims to very precisely locate problem spots where the nerves travel through the body, and you're really gently trying to mobilize by sliding and rolling and gliding directly on the nerve to free it up. And it's really the most basic way to describe it. And there's many people who, actually there's not many, there's a handful of people who are teaching nerve work. I know Michael Shacklock is one of the people that you interviewed, and he's quite a genius. And I was fortunate enough to be able to take a few of his courses. And I think his methods are genius. I think he's really expanding on the work of David Butler, and who was one of the initial pioneers of understanding that nerves actually move in the body. And some people try to refute that, but the simplest way I think about it is that if you bend over to tie your shoe and your nerves don't move, you probably will snap your sciatic nerve if it's not moving, just from simply tying your shoes. So that's the basic theory that I'm going on, that if you can bend over and tie your shoes without severe pain, then your sciatic nerve is probably sliding and gliding freely through the nerve sheath that it travels through from your spine down through your leg all the way down to your toes. And it changes names several times, but it's really, you have one nerve in the body, and it all branches out of the dura from the center of your spine. So the nerve is really just derived from the center line of your spine and branches out and has thousands of different names. So really, nerve mobilization is looking at precisely locating those needles in the haystack and where it might be fixated. So David Butler, he developed methods for physical therapists and other practitioners to be able to diagnose and treat fixations on the nerves. So for peripheral nerves specifically. So he would use kind of similar to how Michael Shacklock, moves a joint, a certain way, maybe extends the elbow to determine if the peripheral nerve is moving freely through the joint. So, above and below, they use different techniques to do tension tests, to determine which nerve is the compromised nerve. So then they would, David Butler went on to, use this movement to try to free the nerve in its pathway. And Michael Shacklock, I think, expanded on David Butler's work to use tensioners and sliders to find the precise location and to try to move it mechanically to try to tension and slide it. And I think, there's another man who's a colleague and friend of mine, Doug Alexander, that used a little bit more of palpation on the nerve and kind of the tissue around it. So he was doing a lot of soft tissue techniques to try to influence the nerve. So that was what was different than Michael Shacklock's work, is there's way less direct palpation of the nerve. And really there wasn't, from the techniques, maybe things have changed since I've taken his courses, but there was really no direct palpation on the nerve itself to try to mobilize the actual the nerve. So Doug Alexander took it a step further and worked on the soft tissues and kind of starting to work on the nerve. And then Jean-Pierre Barral I think, took it the furthest so far and is probably what I'm influenced by the most, and that he had taught to really specifically listen for where the precise fixation is on the nerve and to either work directly on it, which he kind of coined the term nerve bud, which is almost like a muscle spasm. Like, let's say you have a muscle spasm in your neck and it feels like a knot, to the average person, and you rub on it, like, it feels like, a hard spot. So there's actually something called a nerve bud, which is kind of like a muscle spasm on the nerve. So you could literally feel like a bump. It feels like a little ball or like a little BB that you could feel. So, if this is a healthy nerve, it just feels like a little bit like of a small raised spot. And those are crucial to find. You find those, you could literally change somebody's life by getting those areas to release and dissipate. So I think Jean-Pierre Barral expanded on the other people's work and said that you could work kind of above, above and below this spot to try to get it to free, or directly on this fixated spot, which is, he determined that it's basically almost like inflammation. There's intraneural fluid that travels through the nerve that literally gets swollen. The fluid is not moving through the nerve. It turns from a small nerve to a larger nerve, and then it starts to get stuck in the sheath that it's supposed to slide and glide through. So that's where people then start to have symptoms and numbness and tingling and pain, which can range from mild to severe, and they could have trouble with using their muscle. Muscle function can be compromised too. They might have trouble gripping a pencil when they're writing, or they might not be able to move their arm and with strength, like picking up a bag. And